We've been able to vaccinate about 1,400 patients since the start of this project in February. But the significance is not in that number. The significance is in the individual people and the lives that we have been fortunate to change. The COVID Mobile Vaccination Unit is an opportunity for us to connect with our community on a different way by administering vaccines for demographics that has not been vaccinated as equal as others.
What I do with the mobile unit is I take care of all of our community partnerships, community relationships, and our scheduling for future events. Today we're at Durham Technical Community College. This is one of our partnerships that we gained from coming into Durham County.
Everybody has a hand in making this project successful.
Hey, good morning. How are you today?
You want to make sure that they're greeted with the most warm introduction possible. So when they come in, you just make them feel welcome. They're like, we're good to see you, because we are happy to see them. And so when they come in, we just want to make sure first they're on the schedule. Offer them refreshments, make sure they're good on that end, and then we just have them go in and get their vaccine.
Before the pandemic, I was really working part-time, and when the pandemic hit, I've been working much more closely to full-time, and it is just really important to me when there's a healthcare crisis, healthcare workers come in, right? And in this particular organization, you have just seen people who really have a dedication to our community, who really have a dedication to meeting people where they're at with whatever situation they're in.
I was retired happily for 7 years, and I decided I really wanted to be part of this effort, trying to get us out of this pandemic.
You are fully vaccinated. Congratulations.
This is a very difficult and interesting time in our country and in our history, and I really wanted to be part of the solution.
Ya solo estamos dando la segunda dosis, pero ellos pueden ir.
I assist with interpretation, checkout, check-in, site visits, patient recruitment. I do think it is very important to have a native speaker on site. It's important to have someone from the community to help serve the community. I've seen many Latinx patients come in and they seem very comfortable to have the community health worker on site that looks just like them.
I do checkout, meaning I schedule their second doses if they're here for Moderna. If they're here for Johnson & Johnson, then I just check them out, give them more information on what they can expect after they've been fully vaccinated. Being out here face-to-face with the public, answering any kind of questions that they may have, seeing the families come in together, it's a great experience. It's very humbling.
For me, as someone who has always professionally believed in the importance of working directly with communities to provide health care, especially if there's some underlying mistrust due to, the legacies of medical racism and things like that, I think it's been a huge vindication to see how well this has worked. This is an amazing historical moment as a public health professional to be a part of.
People like, oh man, I love this so much, I'm gonna go get my family members, I'm gonna go get my uncle, I'm gonna get my cousin, I'm gonna get my auntie, because we all need to go ahead and get that vaccine. So it's just been a joy to see how pleasant, and people coming in a little bit nervous at first. When they leave, they're like, oh man, this is one of the best decisions I could have done.
Everybody's job is equally as important as anybody else. The people who drive the van here to bring our equipment are as important as the person drawing up the vaccine, who's as important as the person giving the vaccine. The people monitoring people are equally important. Everyone has their job, and I think this really runs like a well-oiled machine.
I have a strong sense that patients come here sometimes tearful, hesitant to get the vaccine, leave with a smile. That lets us know that we've done our part and that the patient's leaving with a great experience.